and welcome to this episode of the Patient Educators Update. My name is Chuck Jones. I'm with Synergy Broadcast, and I'm pleased to welcome our guest today, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Hospital out in Phoenix, Arizona, and she's also the author of the book, No Time to Teach. And that's the book where we take most of our topic information for each episode. And this week, Fran, we are going to reference a chapter called Evaluating Understanding. It's on page 133 in your book. And this actually is something that I can relate to, as I've told you in some of my stories, where it's typically one of the final encounters before discharge. And this is my remembrance, and you reference it in the book, but here's how it goes. From the patient educator, do you understand? The patient replies, yes. Do you have any questions? The patient replies, no. Are you ready to go home? The patient replies, yes. And then the chart entry is patient verbalizes understanding. But do they really?
Oh, that is so wrong. No, because you have absolutely no evidence other than the fact that they said yes. And you don't even know what they're saying yes to.
Yeah.
So, no, there's actually a much better way to do it. And we've talked about it a bit before, the teach back and the show me methods to both evaluate understanding and to know what needs to be taught more or more clearly.
Yeah, we have talked about teach back a lot.
So what I'd like to do is demonstrate it, because one of the pieces of feedback I've gotten from some staff is that they think it takes too long. Mm-hmm. And actually, you can do everything in the shorter amount of time. You can do assessment and evaluation of understanding and teaching all at the same time if you use teach back well. So I kind of like to test it on you.
Oh, sure. Yeah.
So if you could now tell me what you know about teach back.
Sure.
And your understanding, and then this way I don't have to bore you by teaching you about teach back. You can just I can just fill in the gaps.
Yeah.
So
okay.
What do you know about teach back?
Yeah. Sure. Yeah. What I know and understand about teach back is it is a way to understand what the patient actually understands and has committed to something that they can do. In other words, when the nurse is talking to them about how to put on a bandage or how to give an injection or something like that, the teach back would ask them questions about, if you were going to explain this to your husband, what would you do? And you get a response from the patient that is not verbatim what you said, but an interpretation, because they now have to think about it and then relate it to something else. So it gives you, as the nurse, an understanding of they either get it or they don't. And it's important to know either way, because if you understand what they don't know, then you know where to teach. That's kind of where I think it is.
Great. I mean, you hit a lot of the important points. That it involves the evaluation of understanding, knowing what else we need to teach, and also helping them process the information so that they can put it into their own words. So I now understand that you understand and can document that you have a good understanding of teach back.
Yes. Yeah,
so that's how it works.
Yeah, and I would say that it doesn't take a lot of time at all.
It doesn't take any extra time, and in this conversation, you were engaged. You were thinking, you were having a conversation. If
Right.
I just babbled that at you and just lectured to you, you might zone out because you knew it already.
Yes.
So you wouldn't have to listen to it again,
Yeah.
and you wouldn't be interested.
Yeah.
So this served many purposes. It also got you to review the information as you were saying it, so that it made it more ingrained in your understanding.
Yeah, I would totally agree with that, because the more, you're talking about many times changing habits, and that's hard to do. And so the more a person can verbalize what they have to do, they can, I'm not sure I can come up with a word, they have to internalize that into something that they will do and feel comfortable doing it. And so you're right. If you just say, all right, you got to do these 3 things, do you understand? Yes. If you don't ask them to tell it back to you, or how would you explain it to your husband, you don't know if they understand or not.
And the research shows that the more senses you involve in the learning process, the better connections you have between the parts of the brain to bring it up again, to recall.
Yeah. And does that play into the show me part?
Yes, absolutely.
Okay.
Show me is just return demonstration. So if it's a skill that you need to learn, then having the learner repeat it and do it and show you that they know how to do it. And if something goes wrong, that they know what to do. If something goes wrong, do they have a deep understanding of the skill?
Yeah, and I would say that that's pretty important because oftentimes I know with my wife and leaving the doctor or the hospital, we'll talk about, what was said, and many times she'll have a different perspective than I will. And there will always eventually be a discussion of what if something goes wrong, what do you do?
That's real important.
Yeah. Who do you call, or do you need to call anybody? Without a plan, then many times perhaps nothing might get done, and then the patient either doesn't follow through, and that could be anything from taking their meds to doing something else. And there's a lot of research that shows that they don't take their meds after a while. They just stop.
Yeah.
So, okay. Well, that all makes sense to me, and I might point out that we did a full episode on Teach Back early on when we started doing these. It's episode number 2, and I will post a link to the show notes on that. We haven't really done an episode on Show Me. Is there anything particular you want to address with that topic?
The most important thing is that if you get return demonstrations, it's good to get them 3 times if you can over time, not necessarily in a row, because the first time they're just kind of learning it and doing it and may need a little bit of coaching. The second time they should be able to do it on their own. And the third time something may go wrong. They drop a gauze in the middle of a dressing change, and then that gives you an opportunity to help them learn to problem solve, to understand what they were just doing and what needs to be done in response to the problem.
Okay. Now, I notice you use the term, you refer to this as return demonstration. Why is that the verbiage?
Well, the first time you need to show them. Okay. So that's why it's a return when they do it back.
Okay.
So the first time you need to demonstrate it and say what you're doing while you're doing it so that they can put together the words and the actions. And if you can, give them a written piece of paper that has the list of what the steps are, because when they get home, they might get confused once again. So the more reinforcement you can offer, the better.
Yeah, that makes sense. I'll relate a story I've told in a couple of episodes when my wife had shoulder surgery, and the physical therapist brought her some sheets of paper to do her exercises on, and they were the Xerox ones that had been copied so many times. And you could clearly see the confusion on my wife's face as they were going through this. And I asked the physical therapist, I said, can I video this? And I pulled my phone out and was able to capture the exercises as well as the physical therapist's explanation of what to do. And then when I got home, I was able to put that video on the computer for my wife. Now, I know not everybody may be able to do that, but that's another way to help reinforce the show me part of it so that they have a reference to go back to it.
Exactly. And I think right now a lot of organizations are adjusting their policies on videotaping and photographing in the hospital or the organization because more and more people want to do that.
Yes, absolutely. Yeah, it makes total sense. Okay. Well, I think that covers that topic pretty well. Any other thoughts on it?
No, just
okay.
Do it all the time.
Yeah, it's like anything. The more you do it, the more it becomes second nature, and then you do it without even having to think about it, which then would provide you with infinite amounts of time to teach because you don't even know you're doing it.
Exactly.
Okay, cool. Well, why don't you tell folks how they can find you online?
Oh, I have a blog on patient education at notimetoteach.com. And I'm on Twitter at No Time to Teach.
Okay,
Disseminating
cool.
research.
Yeah, and I would tell folks that your book, No Time to Teach, is still available in print, and it's also available in digital form wherever books are sold. I see there's a big flare of light there, but you can find it anywhere books are sold, like Amazon or any of the other booksellers. And then for hospitals that want to do a bulk purchase, they can visit your publisher, which is Pritchett and Hull, and it's a really simple website, p-h.com, and there's a bonus discount for multiple purchases. And I would encourage them to do that because it's a very small book and it'll fit in a pocket, so you ought to have it with you. Now, for those of you who might be interested in using video in education, Synergy Broadcast provides a video on demand system for hospitals and clinics, and it's called MMDS, or Medical Media Delivery System, and you can find it on our website at synergybroadcast.com. And you can also find us on Facebook and Twitter and Google Plus and Pinterest and various and sundry other places. We try to be wherever the people are. So, Fran, with that, I thank you for your time and attention this week, and we'll talk to you next time.
Okay, great. Thank you.
Bye-bye.